Today we're going to talk about hand hygiene for health workers. So there are two different ways that a nurse can use hand hygiene. You can either have soap and water, or you can use an alcohol-based hand rub or hand sanitizer. When you use a hand hygiene for a nurse, you would use it before and after patient care, after contact with body fluids, open wounds, or contaminated areas. For example, areas like close to a patient, like a bedside table, handrail, etc. After doofing/removing gloves, before eating, and after using the bathroom. The uses for soap and water are when your hands are visibly dirty, after known or expected exposure to Clostridium difficile, if your facility is experiencing an outbreak or higher epidemic rates, after known or suspected exposure to patients with infectious diarrhea during norovirus outbreaks, and if exposure to Bacillus anthracis or anthrax is suspected or proven. To show how to wash your hands with soap or water, many faucets are different, and they may vary with the handles. It's not a good idea to wear jewelry during patient care because jewelry has extra germs and they could carry out and infect the patients. But some places like surgery, they very much prohibit wearing jewelry, so that way the germs on your jewelry won't infect the patients. But other places you're allowed to wear like a wedding band, but you just got to make sure that if you're wearing that wedding band, you're going to keep it on when you wash your hands or use hand sanitizer. So you want to turn on warm water, not hot water. If you turn on water that is too hot, it can dry out the skin and it can cause cracks in the skin and become irritating. You don't want to let your scrubs touch the inside of the sink because they can get contaminated because the sink's really dirty usually. Once the water is warm, you want to rinse your hands and make sure that your hands are below your elbows because you don't want any germs on your hands to get like on your arms, elbows, etc.
So once your hands are wet, you want to put out 1 teaspoon or 5 milliliters of soap on your hands. You're using soap and you're going to lather your hands and wrists. Then you're going to scrub with the soap using circular motions with your other hand. This is to remove the germs and any excess stuff or dirt that could be on your hands. You're going to make sure that you're in all the small crevices and you're going to scrub for about 20 seconds. So you're going to start by scrubbing the palms of your hands, once again using a circular motion. Then you're going to move to the backs of your hands, and you're going to do this for both hands, for everything, by the way. Then you're going to move to the thumbs, you're going to scrub the thumbs. Then you're going to scrub each finger, making sure to also scrub the fingernails. Then you're going to scrub through the knuckles. You're going to scrub using the opposite hand. You're going to rub your knuckles against the palm of the opposite hand. Then you're going to scrub in between the fingers, once again getting those crevices. Then you're going to scrub underneath the fingernails, getting all the dirt out. Then you're going to scrub the wrists. You're going to go about 1 inch above the wrists. Then when you're ready, you're going to rinse the soap off with the warm water. You're going to put each hand underneath the water, hands facing downwards, so none of the water and germs gets on your arms or elbows. And you're just going to let the water rinse off the soap. You're not going to use your other hands to push the soap off. You're just going to let the water rinse the hands off. Once the hands are fully rinsed, you're going to use a paper towel to pat your hands dry. You don't want to scrub with the paper towel because that can damage the top layer of skin. Once your hands are pat dry, you're going to throw the wet paper towel away in the trash. Then you're going to grab a dry paper towel and you're going to turn off the faucet with it. That way you're not touching the faucet with your clean hands. And note that you didn't use the wet paper towel to turn off the faucet because the germs on the faucet could transfer through the wet paper towel onto your hands.